Hey, everybody. Welcome to Ask Dr. Testosterone, starring Dr. George Touliatos, brought to you by his books. First of all, we have Bodybuilding, the Good, the Bad, and the Ugly, and available online right now on Amazon.com. Also, his new book, Training, Supplementation. What's the full title, George? I messed it up.
And nutrition supplementation, yes.
I forgot nutrition. Training, Nutrition, Supplementation, and Bodybuilding, available on Amazon.com, as well as his website, gtoul.com. Please welcome from Athens, Greece, Dr. George Touliatos. How are you, George?
Hi, Ron. It's a rainy afternoon in Athens. Have a nice week and a good month and summertime, you know. Hopefully the gyms will open in 2 weeks from now. Otherwise, in 4 weeks, in 3 weeks. Actually, the last week, last Monday of June, it sucks, you know.
We have a state that's just south of me called Rhode Island, and their gyms are opening up today. So
also, Vegas opened on when was it? Las Vegas was weekend, Friday.
I think so, yeah. But I'm just saying a state that's I could drive a half hour to the next state down from me, and their gyms are open now. So I might make a road trip or two every week until my gym's open, because still nothing here.
I was talking to Ray Collins yesterday. He told me that Steve Weinberger doesn't know about his own gym, Bev Francis. You know, it's still not a clear date.
Yeah, New York, they haven't started to open anything yet. I don't think nothing at all has changed in New York. Yeah, they're still locked. Everything's locked down. But it can't go on much longer. I mean, we're into June now. What, are they going to shut everything down for the whole summer? Maybe. Anyway,
let's
get on some questions. Here we go. Number one, do you recommend the approach of microdosing HCG throughout a cycle of TRT? Are there times to take a break from it, or is a desensitization no concern in these small doses?
No, I believe we can use small doses, either 150 or 250, in order to keep the not the HPTA, but the sperm production and the volume of the scrotum.
Yeah.
Desensitize of the LH receptors comes in abusing larger dose, okay? Perhaps prolonged PCT doses like 1500 or 2000 IUs, or some people do 5000 IUs 3 times a week, which is crazy.
Wow.
So yes, we can do this through TRT, and Chrysler also supported that. Minimal doses, you know, daily or every other day, that mimic the natural production of testosterone.
And it would keep working forever. It would, because you know O'Connor talks about he uses it in his practice, but only for limited amounts of time, because.
But how much? How much did?
It's a lot. It's probably 2,500. 2,500 I use.
That's a lot, definitely. I'm talking about 250. I use only 150. Personally, I did it for 3 years consecutive in order to boost my sperm production, and I succeeded in that. But very small portions, you know.
Yeah. But every day you were doing those. You were doing 250 every day.
Every other day, and 150 every day.
Okay, gotcha. All right. So next question. I have done several cycles in the past, and I encountered lots of acne. We get a lot of acne questions, don't we? On my back and face when I'm on, and when I come off the cycle, especially when I'm on PCT, acne will be all over the place. I'm on 300 milligrams of test. That's it. And my PCT is 5,000 IU HCG and Clomid for a few weeks. How do I get rid of acne and have a clear skin? Every week we get that question.
I think the problem is in HCG. He abuses HCG, and I have heard that other men have noticed acne through HCG. And if you abuse HCG, you know, you get also estrogens and also endogenous production of testosterone that will aromatize eventually. So estrogens that perhaps they play some role in acne along with DHT. Now, of course, testosterone that is elevated is reduced either to DHT or aromatized into estradiol. So it's not a good idea to abuse HCG in PCT. So this guy has to use perhaps even less than half of the dose. So 2,000 or 1,500 or even 1,000 units every 3 days. Okay. And also acne, okay, minimize your testosterone dose and use some azelaic acid. And if you want to use some finasteride, because finasteride cuts off DHT, then perhaps this DHT, which is the substrate for acne, will get diminished, and perhaps we have some improvement in acne. The point is, if you cut off DHT, then you have issues with your mood and with your sex drive.
Here we go. No free lunch, guys. It's always something.
There's a flip side to every coin.
You fix one thing, you get another problem. Here we go. Can you use Clomid on TRT to help LH receptors instead of HCG? If so, what protocol?
No, I don't think so. Clomid is beneficial within. Besides Clomid, if you use it for a prolonged time, you had horrible moodiness and blurred vision. It affects the retina, and it affects also the brain with the estrogens. And Clomid, besides, elevates HBG, which is not a good idea because it will lower your free testosterone and then your sex drive will go down. So HCG is the real deal in order to kick your balls, you know. Yeah. Now, clomiphene is useful without using testosterone, and perhaps when you want to kick your HPTA after your HCG, perhaps under secondary hypogonadism, but it's not a good idea to use clomiphene for a long period of time. Sometimes it helps, but it helps only in paper. The clinical data say that it's not a good idea to kick your testosterone by clomiphene.
Yeah. And we had that whole show I did with Dr. O'Connor probably about 2 years ago with that young man that went blind. It was Clomid. Yeah. Is it Clomid? Yeah. Oh, that was scary. Here we go. Dr. T, I have an important follow-up question about minoxidil and azelaic acid and blocking DHT. This could concern many bodybuilders who take minoxidil, which is very common in our community, as you know. Does this only happen locally and topically on the scalp, or is some of the drug taken up systemically and then causes the whole body's DHT to drop or become less effective? I love DHT and I also like minoxidil, which I've taken for 2 years already. But if there's any chance that minoxidil messes up my DHT systemically, I would immediately stop it and rather go bald. So.
Oh, it doesn't affect. I think it's applied locally, and also finasteride can be applied locally in powder form in solution that you can put it after you wash your hair. But minoxidil and ketoconazole are in foam and in shampoo, so it's applied locally and not systemic. Therefore, they don't mess up with your libido and with your mood, unlike finasteride taken orally and not finasteride taken applied locally. Now, azelaic acid doesn't have to do anything, I think, with sex drive. It just kills the DHT on the spots that you have with acne, and therefore it helps. But no, it doesn't affect the DHT systemically. Also, the azelaic acid. It's just in the
local.
Yeah, locally.
Okay. Next question: how important is it to come off TRT to boost fertility versus staying TRT and using HCG, HMG, Clomid, Nolvadex, and Proviron? Also, how important? Yeah, answer that one first, I guess.
The point is that if you take off testosterone in order to boost fertility, I mean, because if you use testosterone, apparently there is a shut off in FSH and in spermatogenesis. And perhaps with this idea, it would be better to kick your sperm cells by using the other agents like HCG, HMG, mesterolone, clomiphene, or vitamin E. The point is, without testosterone, how the heck are you going to have erections and sex drive? Okay?
Yeah.
So unless you want to masturbate and IVF.
Well, I mean, without a sex drive and erections, you can't even masturbate. So.
Okay, you know, perhaps take a Viagra, you know, and see a couple of movies, but it's pointless.
Yeah. Okay. He had a second part to that question. How important is HMG for fertility? HMG is very expensive. Do you have any recommendations on dosages?
It is, and it comes in Greece in 75 I use it. I think this is the drug Merional, Merioforte, that is synthetic FSH, and it comes in $15 about, but you need at least three doses per week. You know, about so $75 to $50 per week, and it's a lot of cost in relation to HCG, but it's very effective, and combination of both It's very good. Also, perhaps I think HMG contains also some alates also. So it's like Pregnyl and FSH synthetic together, and it's very effective.
I keep confusing it with that old supplement, HMB. Remember that one?
HMB, yes.
Totally different.
Methylbutyrate, yeah.
Here we go, another Clen. I think every week we get a Clen question and we get an acne question. So here's your Clen question of the week. Is Clen the best cutting drug? What is the best dose for a beginner? Due to the half-life, should someone take it for 2 days, then stop for 2 and continue like this? What are the best doses to have the positive effects but minimize the sides? And how should someone spread the dose during the day, for example, morning or afternoon or evening? So how should people use Clen if they're going to use it?
Or that Clen works 2 days on, 2 days off, and not 3 weeks on and 3 weeks off, because the receptors are very sensitive, so they get saturated pretty easy, and then you have to use Zaritan or ketotifen in order to unlock the receptors, and be effective. The point is, clenbuterol, that elevates also blood pressure, and then you have a nasty cervical pain over here. It's perfectly stacked with T3. T3 is more potent than T4. So T3 in clenbuterol is even more effective than ephedrine aspirin stack. And actually, clenbuterol improves the bronchodilation and maximum oxygen consumption capacity, which is very good for cycling, for instance, for endurance marathon, for instance, or even some cardio, empty stomach in the morning. It works like albuterol and the bronchodilates, a beta-2 agonist. Unlike the ephedrine, the ECA stack, that gives you intensity pre-workout in order to do a heavy squat, for instance, very, very intense. Of course, we have also amphetamines that suppress appetite a lot and are also very effective for thermogenesis. Actually, amphetamines, they are the all-time classic drug from the 60s, from the medical community.
Yeah.
So clenbuterol, yes, has to be used 2 days on, 2 days off. A very safe protocol would be 20 micrograms in the morning, 20 micrograms in the afternoon. But some people may stack it up to 120, so 6 pills. Two. I've heard also 10 pills a day, which is crazy. But then you need to stop using it because you no longer react in a positive way by taking clenbuterol. It doesn't work. Then you need to increase the dose, and this is very risky.
Yeah. I mean, people typically start out on low doses, and as the weeks go by, they build up the doses.
Yes, exactly.
But yeah, like you said, once you're up to like 120 or 140,
I believe, Ron, this is a 20% kick in your BMR. If you don't diet hard, if you don't do your cardio, then don't expect to bury your fire out of this thing.
20%, that's a big boost.
I guess so. It's a 20% kick.
Okay. Here's one here. Common oral health-related complaints of patients using either an AI or tamoxifen included increases in gingival inflammation, gingival bleeding, xerostomia, and burning sensations in oral tissues. Every bodybuilder lose their teeth during PCT, and nobody's talking about it. I've never heard of that. Come on. Please, Doc, I want your opinion. How do I avoid that side effect? Losing teeth.
Yeah, I mean, I've heard of that by heroin users or Dumbating users, losing your teeth. But this is very extreme. Now, if this happens, then stop using it, obviously. But I never heard of it before. One of the symptoms were a dry mouth in Greek, I'm not sure about it. I never heard. But if it's so horrible for you, then stop using it and use clomiphene instead of tamoxifen,
If this was such a common side effect, I would have heard about it. People would be
me too. Yeah.
People,
perhaps he's using some other drugs. I don't know.
Yeah, make methamphetamine, because I mean,
this is also gingivitis.
Yeah.
What he prescribed.
I would notice people walking around with no teeth. That'd be pretty obvious. Here we go. How do you control the DHT elevation occurring from DHT derivatives? I use finasteride 1 milligram every day to control my DHT elevation from test.
It doesn't work. 5-reductase inhibitors work only for testosterone, not for testosterone derivatives or synthetic testosterone. So no Primo, Winster, Anavar, no Provider, no Masteron, just for testosterone. So if you take it, it's useless,
Hmm.
There's no point. So reduce, take it off, and just use testosterone. Otherwise, take it or leave it, accept it.
Okay, next question is kind of relevant because people are mega dosing on zinc now because of COVID-19. So this person wants to know, Doc, I want to know, does zinc inhibit DHT?
No, but it inhibits estradiol, not DHT.
Mm.
However, when you inhibit estradiol, it's the other pathway, so DHT elevates. It's like cutting off DHT, then you increase the other metabolite, which is estradiol.
Okay.
That's why when you take off, when you use finasteride, some people, out of the absence of DHT, they notice gynecomastia,
Mm.
and also E2 elevates.
Gotcha. Next one. How do you reverse insulin resistance from obesity? Is it as simple as losing weight?
It's also a reduction in visceral fat or mental fat. It's also by introduction of fiber, introduction of essential fatty acids, lean animal protein, intermittent fasting, metformin, chromium picolinate, that everything of them improves insulin sensitivity. And also getting some more muscle, because muscle burns glucose, and muscle improves the glucose sensitivity, and glucose gets into the muscles, into the cells easier by having muscle,
Cool. Next one. Do you think that topical, not systemic, corticosteroids applied on the scrotum for a long period of time could suppress the HPTA axis after the end of the corticosteroid cream treatment in the scrotal area? Should the patient ask for a hormonal hormonal blood test, FSH, LH, total T, free T, and think about PCT? So why would people be putting corticosteroids on their scrotum?
Because cortisone suppresses testosterone, but the point here is not testosterone that much. It's about the hypothalamic pituitary gonad. Adrenal axis. Okay. Yeah. So if you cut off abruptly in cold turkey your cortisone or your corticosteroids, then you're gonna have insufficiency in hypothalamic pituitary adrenal axis, like we described the Addison's syndrome, or the adrenal fatigue, for instance. Okay, so we need to gradually, every kind of hormone that is administered, either it is cortisol or testosterone or thyroid hormone, has to be tapered down, gradually. So if you shock the system, then you're gonna have issues with the axis.
Yeah. I'm still wondering, corticosteroids, they're for other purposes, but why would they be put on the scrotum? Have you ever heard of that?
No.
Yeah.
Perhaps for optimal absorption, but I never heard of it. Perhaps you use corticosteroids in some creams for some infections,
Yeah.
And they have also prednisolone, I think. But you have to put it, to stop it gradually.
I wonder if that was a troll question. Were they trolling us, doctor? I don't know. I don't know. Okay, next one is, it's all about his cycle. This is a long one, so here we go. Big breath. I'm 38 and ended my first 16-week cycle in mid-February. It was 600 milligrams testananthate and 500 milligrams EQ. He put E, but I think I've never heard of EQ and anthate. Stopped everything for 6 weeks without PCT, and then started a TRT protocol with 150 milligrams testananthate for 10 weeks. Mid-June, that's coming up in 2 weeks, I will start my second cycle for 12 to 14 weeks. It's going to be 750 milligrams test D and 600 milligrams EQ for the whole period. Additionally, I will add 400 milligrams Masteron E for the last 5 weeks and Anavar 30 milligrams a day for 4 weeks. First question, is this cycle legit or could there be a better way to proceed? I don't like DECA or D-ball, prefer lean gains. Trend is out of the question for me. So that's his first question. He wants to know, what do you think of that cycle?
Could you repeat the substances?
Sure. So the cycle he wants to do for starting soon is 750 testananthate weekly, 600 milligrams EQ. And then the last 5 weeks, he's going to introduce 400 milligrams Masteron E. And the last 4 weeks, he's adding in Anavar at 30 milligrams a day.
Yes, but instead of Anavar, he could add some Primo.
Oh, okay.
In order to avoid the liver toxicity,
So he's talking about lean gains. This seems more like almost like a contest prep cycle, except for the I don't know. I wish he had said what he was trying to accomplish with the cycle. Because if you're trying to make lean gains, why would you kick in like Masteron at the end and Anavar? That sounds like
For the
the
water
last.
retention, for the water retention, perhaps.
Yeah, and I just want to point it out. He doesn't like Decker or D-ball because he wants lean gains, but you can still make lean gains. You're just going to be a little puffy. You're going to have a little water retention. People are very confused. They think certain steroids will make you leaner and some will make you fatter, or
Not if you're already fat.
Right. Okay. Second question. After that, I want to start a PCT, which looks like this: 1500 IU HCG for 3 weeks. He's going to do that every 3 days. So 1500 IU HCG every 3 days for 3 weeks. 50 milligrams Clomid and 20 milligrams Nolvadex a day for 2 weeks. And then 25 milligrams Clomid and 20 milligrams Nolva for the last 2 weeks. Since the testosterone is the only androgenic component, I wonder if this PCT protocol is not too harsh. I should add that my sperm production is still working and my lab results are also good in general. It also makes me wonder how much muscle mass I will lose afterwards if I continue to eat and train properly. We don't have the answer to that, sir. Best regards from Switzerland. So he wants to know about that PCT protocol. Is that too much?
It is pretty solid. It's okay. Now, about the gains, it's up to you, guy. Yeah. It's whether you train hard, if you rest, if you take your supplements, if you sleep. Okay.
Yeah. You're still not going to keep 100% of your gains no matter what, but
never.
I mean, if that was the case,
we're talking about about the 20%.
I think it range. I've seen. It depends on the person.
If you rebound and gain some fat, doesn't mean that this fat in rebound is gains.
True.
I mean, in the same body fat percentage we're talking about.
Right. But I'm saying if you put on 5 pounds of muscle over the course of a cycle, I think you should be able to keep 2 to 2.5 pounds of that, I think. If you're doing everything right. If you're 50% eating.
50% is a very good scenario. 50%.
It'd be great. I mean, do that over and over and over again. That's a lot of permanent muscle.
Yeah.
Okay, next question. I'm 5'5", 205 pounds, 12 to 13% body fat, decent 6-pack, maybe 4-pack, but in my case, it looks good and tight. No blubber or wetness. I'm running maintenance calories and also running 1,300 milligrams of gear per week. I work out religiously 5 times a week. I take 2 IU/GH AM and 2 IU/GH PM. If I introduce 10 IU of Lantus insulin a day without changing anything else, what effect would that have on my physique? I would like to stay at 13% body fat.
Now, the Lantus, I guess, is the slow release, and I'm not a fan of it. I prefer the Humulin, which is the fast acting right after your workout or in the morning, because you know the specific timing of the kick and you know that it works fast and at the time when the muscles are thirsty, you have this kind of anabolic window. But also it matters, as Milos told you, that it depends highly on your diet, what you eat. Now, insulin can be very dangerous for hypoglycemic coma, but also can be extremely safe as the diabetic patients use it safely, But you have to eat a certain amount of carbs and specific amount of units, Don't fool around with this. Now, if you shoot insulin pre-workout, you may have an excessive, bloating or pump, amazing pump. The point is that if, for instance, you're gonna push it to the limit and do a heavy workout, unless you don't have this carbohydrate solution or you pressure yourself a lot and you burn your glycogen stores, then you're gonna faint. And I have experienced that in a guy who is now an IFBB pro, and he almost fainted after a heavy back workout in front of me,
Wow. Yeah, I mean, that's why it became popular.
He was using pre-workout.
Pre-workout. So was he drinking like a Gatorade or some kind of drink with carbs in it while he trained?
Gatorade is only 6% carbs. We're talking about here Maximize, how it's called, Whey Max, which is, I think it's about polymers of starch. But I've tried it once, it's very heavy to the stomach. It's hypertonic and leaves the stomach really, really slow. Yeah. And you have this kind of feeling that you don't want to eat anything and even drink water, Right. And you get so bloated with insulin pre-workout, Yeah. You become like a balloon.
Yeah, I remember when I was using insulin, I used it for one winter, and I was drinking the carb. I think I was with Gaspari at the time. I think it was the glycofuse, but I couldn't handle. It's just such a heavy feeling in your stomach when you're trying to train.
Yeah.
After that, I said, "This I can only drink water. You can't drink something heavy while you train, especially
Mm-hmm.
if you're doing back or legs. It's just you feel like you're gonna vomit." Anyway,
Yeah, disgusting.
next question. I purchased testosterone 400 milligrams per milliliter, and it hurts for days after injecting. Can I add an oil to dilute it or mix it with testcypionate 200 milligrams per mil?
No, I think you should use only CPNate because 400 milligrams
Mm,
in 1 ml is really compact and dense and gonna hurt a lot. You're gonna do an abscess eventually.
yep.
So stick on the pharmaceutical grade of 200 or 215 Untitled in Europe.
Mm,
So
yeah.
forget about this 400 stuff. Perhaps professional bodybuilders use it in order to stick a lot of milligrams, and
Yeah.
avoid a lot of oil, but they had almost twice the departments of what we have.
Yeah. I mean, the only times I've ever gotten like an abscess, I didn't get an abscess, but came very close, and it was some super high concentrate like that. So I learned to stay away. And I've talked to a lot of people, and when they've had problems with injections, I said, "What were you pinning?" And they said, "Oh, this T400, or I've heard T500." I'm like, yeah,
So
don't
this,
even.
this guy's glute may be big Ram's dealt.
Yeah, Big Rami's got delts the size of most guys' glutes. You're right. Okay, our final question. We didn't get 20 questions this week. If a guy has high normal, I don't know if he meant to put this S in front of the DHEA. I've never heard of SDHEA. If a guy has high normal DHEA but very low progesterone, would you have him supplement with progesterone in the form of a cream or some other type of progesterone?
He can use pregnenolone, which is safer,
Okay.
because progesterone is a female supplement. It's elevated in women. In men, it's supposed to be low, the progesterone. So better to take pregnenolone that also converts the next step is progesterone. And DHEAS is the active form of DHEA in the blood.
Okay.
Okay, so take pregnenolone that I also do and DHEA myself.
Gotcha. That's all our questions, Doctor. Thank you so
All right.
much. That was an easy week, huh? But I want to encourage you guys, if you have questions, please leave them in the comments section below. We will get to all of them if you get to them by the end of Sunday. So don't go putting your questions on old videos. I'm never going to look at those and give them to the doctor. So
So
stay
my
firm.
next 4 articles on MD would be testosterone. On June is testosterone, it's 3 pages.
Ah,
Then on July is growth hormone, insulin, and IGF-1, another 3 pages. On August is major steroid profiles, 4 pages.
oh, wow.
And on September would be CNS stimulants. So
Oh,
it's a hardcore period.
jam. You're getting everybody ready for the Olympia. So that's going to be the next 4 issues of Muscular Development Print Magazine. Also, guys, every Tuesday, this video posts on YouTube and on the Muscular Development site. And we also have a new article every week by Dr. Tuliatos on the website,
Tomorrow
musculardevelopment.com.
we're gonna have the major injectable
Ah,
steroids.
okay. So that's why we call it Dr. T Tuesdays. Easy
Yeah.
to remember, guys, right? Dr. T Tuesdays. That's, if you're wondering, when do these videos come out? It's always Tuesday, guys. Always Tuesday.
By
So,
Friday, I'm gonna have my new book, so I'll mail it to you in order to have it by the end of June. Okay.
oh, awesome. I'm looking forward to reading that. Yeah, I like this last book, guys. If you haven't picked it up, a lot of information packed into one book, a lot of information and fun stuff too, like greatest bodybuilders of all time. It's got a lot of info, but then he's got a lot of cool, fun stuff just to entertain you too. So appreciate that. Check that book out, guys. Dr. Tuliatos, thank you so much. Looking forward to another week of hopefully the world getting better. Hopefully. This is a rough week here in the U.S., but
And never take a day off afterwards, until September, perhaps the next quarantine.
yeah, next quarantine. No, no. I hate to think that we're going to have another quarantine like in the winter, but man, because you imagine here with the snow and all that and people stuck inside. Ooh, bad news. It'd be like the movie The Shining.
Yes, I'm gonna buy a couple of pairs of dumbbells.
Yeah.
I have to.
You- I would, if I were you, do you have space to have like a power rack or something?
Yes.
I would just get a whole whole bench and barbell and plates and everything. You never know what's going to happen.
Yeah.
You know, if you have the room. I don't have the room here. But anyway, cool. Dr. Tuliatos, thank you so much for all your information, your expertise. Appreciate it very much. Appreciate you guys watching our show. Please subscribe to the channel. Hit the like button if you like the video. Subscribe with the and hit the bell thing so you know we have new videos out. And that's it. Thanks for watching. Ask Dr. Testosterone. We'll see you next time. Bye-bye.